To start off today, I would like to congratulate Mobile Commons on the success that you have had with the campaigns you have implemented thus far. You recognize that the public's demand for information was evolving to a point where people want their information as easily and immediately as possible. You responded with a platform that enables an additional layer of personalization to help enhance the customer service experience by not only resolving an issue, but also following up with maintenance information as well as new information to help enrich the consumer's experience. And you have been able to provide this service at a fraction of the cost of usual customer service expenses due to the reduced number of personnel, in addition to the lower cost of this technology. Some of the areas where you've been most successful are with brand management, for example. You've reached out to consumers and invited them into the inner circle with their favorite brand superstars. For example, Martha Stewart sends people her favorite recipes or sends them coupons inviting them to purchase some of her goods in the stores. You were able most recently to help a town in literally their darkest hour by providing services during Hurricane Sandy. Number one, giving information as far as where shelters were, how people could help, and also people were able to dial in and get returned information that told them which subways were functioning and which ones weren't. At the same time, this turned out to be a great learning experience when the mobile services were cut off, which allowed you all to respond and look into some questions as far as how to maintain consistent service. Other areas where you've been able to be very beneficial are through philanthropic endeavors. Not only have you raised millions of dollars, but you've also provided the communication encouraging people to get out and vote and to lobby for what they believe in. The fourth area that you've been so successful in is with healthcare and helping people form proactive, positive habits, whether it's quitting smoking or perhaps trying to lose weight. Not only have you provided encouraging texts to keep people on track, but you've also helped them set goals, realistic goals and timelines, and adjusted it when necessary. You also provide amazing recipes and also reminders to get out and be active. Now, we've noticed that most of your success comes from the Generation X and Millennial groups. And that's to be expected considering that most of your business has come from word of mouth based on the success of the campaigns that you've implemented thus far. However, we feel that if you're looking to dive a little bit deeper into the world of healthcare, that there's a large demographic group that can't be overlooked at this time. This group is baby boomers. 2010 saw the first of the baby boomers turning 65 years old. Between 2010 and 2030, there will be a steady stream of baby boomers making up 16 to 18% of our population who will be 65 or older. Knowing that the baby boomers make up over 25% of our population, their aging is being felt. It's impacting the doctors and the nurses and the healthcare providers who are taking care of them. Coupled with the information that it is less expensive to proactively treat health issues than it is to deal with them when they've become an emergency, it behooves us all to try to take a closer look at this. Now let's take a moment and look at baby boomers and what they value so we can get a closer idea of what it is they hope to maintain at this point in their life. Right now, baby boomers' biggest priority is to maintain their freedom and their quality of life. They would much rather stay independent in their own home as opposed to living in assisted living. Now, baby boomers want to feel secure, and they are often suspicious of government agencies and even technology. Above all, relationships come first. Relationships with their family, relationships with their friends, and even their doctors. The baby boomers also value trust. They trust their doctors and the information that they receive. They also trust the internet. However, we find that when it comes to keeping up with technology, there are large inconsistencies in this age group. Now, keeping with your statistic that 96% of all people do own a cell phone, it is a significantly smaller percentage of baby boomers that actually would consider themselves cell phone users. So what are the baby boomers doing on the internet? Well, they're looking up health issues and health questions. When they have a reason to call the doctor, a lot of times they will do their research online first. This not only helps them specify what may be the issue, but it also just gives them a little bit of background knowledge that they can bring in and chat longer with the doctor. Many baby boomers are shoppers online, as well as also researching the information that they need at this time in their life from the government, such as information on how to sign up for AARP, or also how to get their Social Security taken care of. Now, when it comes to mobile technology and their cell phones, the baby boomers are using their phones primarily for emergencies. However, there are a few that do like the convenience of being able to make phone calls to their friends and family. However, most of them maintain a landline at home for that purpose. And then, of course, there are a few who do like the convenience of being able to send photos on their mobile phones. However, we've noticed that many of them really dislike how small the words are on screen, how their fingers feel so large compared to what they're trying to access on screen or with the buttons on the phone. So many just find that it's rather clunky and they don't prefer to use it.
Our research and interviews with seniors 65 years of age and older identified that 54% are currently text messaging. Of the seniors in our study that did utilize text messaging, 25% identified that items such as cost, font size, and keyboard size were factors they disliked about the technology. Despite that, 69% of seniors in the study are currently receiving mobile alerts on their cell phones. And over half of respondents indicated they would be willing to receive personal health information, provided that it came from their physician or another trusted healthcare provider. This indicates that not only are seniors open to the technology, but with the right tailoring such as simple screens and instructions, they would be willing to adopt the platform. We have a unique opportunity to tap into a currently uncharted market.
Our research supported previous theories on seniors and technology use, which allow us to give you some concrete recommendations to improve your technology with an older population. Seniors tend to take information about their health, such as appointment reminders or prescription instructions, and write reminders for themselves that they'll find more useful than a text message. The text message should also come from their doctor's office if possible. Our research indicated that seniors were not very trusting of people they didn't know and are wary of any kind of spam text messages or things that'll just clutter their text message inbox. Seniors trust their doctor and prefer to see their doctor in person when possible. A lot of seniors also still rely on doctors' offices to call their landline to remind them of upcoming appointments or other tasks related to their health. Our interviews also indicated that seniors are more open to receiving updates about upcoming appointments or benefits rather than reminders about medication or other personal health information. Although the service could help seniors maintain some independence with these reminders, many seniors take pride in being in control of their health and remembering on their own when they're supposed to take their medication. Some features may be too invasive and offend seniors rather than help them. Through our research, we also realized how personal people's health history is, so you want to ensure the seniors that their security is your top priority. Working in collaboration with doctors and healthcare providers who seniors know have access to their health information will build trust. Think about having a backup phone number on file, such as the phone number of a family member that they can designate, or a landline so that the senior can be reached if there is ever a problem or breach of security with the system. Also be sure to have encrypted databases so that others can't access any personal information, and reassure seniors that their information will not be used for any other purposes, like spam. You should never sell your database information. Reliability is also going to be important when reaching out to seniors or anyone for health-related services. We learned from Hurricane Sandy that sometimes things beyond our control will knock out mobile phone service. Although, as you mentioned to us in your interview, cell towers are typically more reliable than landlines. You should still consider a hotline or 800 number as a backup that can be used during an emergency situation. The baby boomers we interviewed were social and were talking to family members and friends about benefits and government programs. As research and our interviews also showed, seniors are willing to consider new technologies if introduced to them by a friend or family member and some basic training is provided. Your strategy should include some form of encouragement or reward if seniors share this information with others. If they love the product, tell a friend or family member. If they are having difficulty with the product, encourage them to let you have the opportunity to fix it first. Consider providing incentives for seniors that refer others to use the technology. For example, you could give perks such as a discount on the service or an upgraded phone if seniors refer one or more people to adopt the Mobile Commons technology. You cannot fully immerse yourself in the healthcare industry without making attempts to reach the older population. You have to find a way to reach this market. One way to expand outreach is to set up incentive programs for hospitals, doctors, and other users, even for non-health related campaigns, to share the information on how you can partner with them on their healthcare services. Our research indicates that seniors would be more likely to join and use the technology if there were insurance benefits or other forms of cost savings or incentives. Cost savings provide seniors with a tangible benefit for using the technology, and seniors have to see value in the technology if they are going to use it. Some examples of incentives may include, for hospitals, the hospital would be eligible to earn rewards, and for example, Mobile Commons could cover the cost of a guest speaker, like Dr. Oz, to come to your hospital and speak on heart health. The benefits could also be tied to other wellness programs associated with the hospital. For doctors, examples include reduction in overall fees, or doctors could also be eligible to earn rewards like credit to purchase extra educational or fun materials for patients that they could take home to help them live healthier lives. For current users, every 3 friends that you refer that sign up with our service, you could be eligible to earn rewards like a free exercise class or free foods at participating supermarkets. Other incentives could be reduced costs or an upgraded cell phone. As we mentioned before, negotiating relationships with insurance companies would be beneficial and likely increase senior participation. For example, if seniors signed up with the service, then they could qualify for a proactively healthy discount on their annual insurance costs. Seniors are on a fixed income, and many of the seniors we interviewed said they would likely join and use the service if it saved them money on their health insurance. Our research also supported previous studies on seniors and technology, and that technology needs to be designed to the motor skills and cognitive capabilities of seniors. Seniors typically have declining eyesight, hand or finger motion due to arthritis, and some have declining cognitive abilities, all of which inhibit use of complex technology. Many seniors have simple mobile phones without the full keyboard and are not smartphone users. Thus, you cannot expect seniors to be able to reply to text messages with lengthy sentences. Not asking seniors to reply at all would be ideal. Another suggestion would be to design a specific device that could be purchased for use with the Mobile Commons service. This device could have a simple keyboard or a slide-out keyboard like some mobile phones, or have larger numbers and a larger screen so that seniors can view it easily. Expanding into the healthcare industry requires that you address seniors and attempt to make your technology available to them. The baby boomer population is one of the largest growing populations in the United States. Mobile Commons has the potential to have a positive impact on the older population's health. This will be an exciting time for Mobile Commons to help bridge the communication gap and help ease the transition for baby boomers as they enter into the next phase of their lives. This technology can work with seniors if you adjust your product accordingly and respond to the needs of senior citizens.